All right, it's Monday, everybody. We want to welcome you into Coronavirus Inside the Arizona Numbers. A lot of better, more hopeful news to talk about today, which is always a relief to Garrett and I. I'm sure it is to all of you, too, that we're making some progress on all of this. We'll touch on everything related to Arizona, and we'll also answer your questions about where to find Arizona-specific data. We'll help walk you through the numbers and better understand all the charts and graphs you're seeing online so that you can make the best decisions for your family and your life. We're simply here to guide you through that. Some notable things that happened over the weekend. We did pass 5 million cases here in the United States. We have 187,000 cases here in Arizona. So we'll talk about all of that. And we're very, very close now, sadly, to 20 million cases globally. So we'll talk about that throughout the hour, but let's get right in, Garrett, to the Arizona-specific numbers that we always do from the Department of Health's website.
All right, so we've got the summary page pulled up at the AZDHS. We have 187,000 cases and then 4,154 deaths. That is throughout the entire pandemic. Today, it is a Monday, so it's a low reporting day. 600 new cases added with 4 deaths. The 600 cases comes off of 5,655 diagnostic tests as well as 1,155 serology tests. So that gives us, as you can see, the percent positive, the cumulative percent positive has gone down from 14.1 to 14.0. And the serology percent positive, I believe that's gone up 1 to 5.7. I think it was 5.6 yesterday. Today and yesterday were the first days that we've had under 1,000 cases reported for 2 consecutive days since early June. So that's really good. These are low reporting days, but even with those low reporting days taken in consideration, it has been since early June when we had that that milestone.
Garrett, are you saying that milestone overall, or that milestone simply for a Monday?
We always have low reporting days. And it used to be back in June, it was Mondays and Tuesdays that were the low reporting days. It shifted to Sundays and Mondays. And they said yesterday and today were the first. Let me pull up yesterday's. Yesterday and today were the first days we've had 2 consecutive days under 1,000 since I think it's June 1st. Let me see. It's June 8th and 9th was the last time that happened, which was a Monday and Tuesday. Because yesterday we did about 816 tests, positive cases, and then today 600. And about 17, and yesterday was the deaths were 13 yesterday. So about 17 over the weekend.
Yeah, so Zachary's asking, are the numbers really going down? In this case, it seems that they are. Of course, we're always adding more numbers on, but the rate of growth is so much slower.
The rate of growth is much slower right now than it is, and it does continue to go down. The percent positives we have, there's a couple ways you can calculate the percent positives. One is just to take the case number and divide it against the PCR, and that one is 10.6%. Very low number, and that one's usually the highest of the 3 estimates because there are serology positives, antibody positives in the system. So 10.6 on the just PCR or cases to PCR tests. In total, the daily report, it was 8.8%. That includes the antibody tests. But then now the Department of Health finally gave us a way to calculate out the actual diagnostic tests based on the electronic reporting. They finally gave us those numbers so we can give you a true estimate of, and when I say estimate, it is everything's always an estimate, but it's still, this is the most accurate number we've ever been able to give for the PCR tests, the diagnostic tests, and that daily report number was about 6.5% today.
And that's the number they're using to base schools on, Garrett?
That is going to be the number that is closest to what the schools will be based off of, is that 6.5%. They're actually going to be using the epi curves to do it, which is the actual date of collection to the date of tests. But that, now that our tests are coming in so quickly, that 6.5% is going to be closer to what's actually going to happen. Back in July, when we were doing these estimates, we were rounding out estimates for this PCR estimate. It was hard to get the number A, and then B, we're talking about it was cases that were coming in with a 16-day lag. So any time over the past 16 days, we could have had cases and tests added. Now we're looking at cases and tests being added within 36 hours. So that 6.5% is way more reflective of what's going on right now than any sort of these daily reported percent positives we've had for quite some time.
So the one bit of caution in this conversation is we've been to this low point, this lower point before, and we didn't have certain precautions put into place, that being masking in Maricopa County, that being some of these other businesses like bars and clubs and gyms open up. So we've been at this place before, and for lack of a better word, we've messed it up before. So there is room to change the curve again if we don't stay true to what we're doing right now.
You can see right here, this is where we were what you're talking about as far as when we have been at that point. And yes, we have. Around April 26th, we were we were still in shutdown, and we had a percent positive of 7% for that week. As you can see, about 21,000 tests. We then reopened the state right here. But one of the problems we had at the time, not just with all the stuff you talked about regarding mitigation strategies, but the fact that these tests that we're seeing on this curve, they were being done for basically medical professionals and long-term care facilities. So we did not have community testing at the time. Now, when we look at where we are now with this bending curve right here, and we are, as you can see, 9% for August 2nd, that comes with the availability of community testing now. So that's to me the biggest difference in where we were as to where we are now. Now, if for some reason things start to turn around, we start seeing surges in numbers at some point, our infrastructure can now handle that surge, whereas we were chasing the virus by about 4 weeks back in May. Now we won't be chasing the virus. We'll be chasing it, about a week. We're always going to be chasing it about a week or 2 weeks, but it's not going to be anywhere near what it was back then.
So we're always at the mercy of what our lag time is on test reporting. Is that right?
In many ways, yes. So for example, right now we're getting tests back within 36 hours. However, this is also with a lack of testing demand. We don't know. I mean, we know that SonoraQuest has told us they have the capacity to do these tests sort of should a surge come in. We have no reason to not believe them on that, but we also haven't tested it. And you don't want to test it, obviously, because that means there's a surge of people going in to get tested. So, what we, if that were to occur, if a surge in testing were to start to occur, will there be the long lines? Will there be the lag time of 7, 8, 9, 10, 12 days of waiting for tests to get back? That's the really bad stuff, because then, we can't do any sort of contact tracing when it takes 16 days to get a test back. At least with 36 hours, they have a chance. The health department does have a chance at around 3 days getting the test back.
Carrie with an I asks, how accurate are these numbers now? I'm a little suspicious since all numbers are being sent to the White House first. Well, we can ease Carrie's suspicions a little bit, because we're circumventing any of that conversation by simply, we get our numbers right from the state. So what the state does with the numbers, whether they go to the White House or the CDC or wherever they go, we're getting them first in line right there. So it doesn't matter for this reporting where it's sent after.
Correct, and that's the thing. I know that there's this sort of rumor going around that the Health and Human Services is manipulating the data. A couple things to notice about that. The Health and Human Services is only concerned with hospitalization data. They're not looking at this case test data that we have on this dashboard. The only stuff that they have is the hospitalization. And we're seeing data from the dashboard directly reported from the hospitals and from the case, the Department of Health. It doesn't go through the HHS first and then be propagated onto this dashboard. It goes directly to this dashboard and then is sent to the Health and Human Services. So if there is quote unquote manipulation of the data, it's going to be in the national numbers, the national aggregated numbers. It has nothing to do with what we're seeing right here.
Yeah, thank you for clearing that up. We're seeing some familiar faces jump on here today, so we want to welcome all of you. And if you have specific questions about data and where to find that, we can help direct you to the appropriate website or the appropriate charts that we've been staring at for months and months now, and help you find this information. I want to talk about the R0 number. And let's see, we reported to folks that the error bar, the whole strip of how high it could be or how low it could be, is below 1. We told everybody that on Friday. That's important because we were the first state in the country to get to that point. But I understand we have a joiner now, Garrett. We have somebody, another state, a neighboring state, if you will. So that's good news too. Joining us on that. How does RT.live look today?
So the rate of transmission, the RT, or not, as you can see, Arizona still has the lowest rate of transmission estimate in the country. The error bars are all below 1 at this point, so 0.65 to 0.98, meaning that as far as the best guess and estimate of the people who put this together is that at this time, the virus is not growing. And you can see we are now joined by New Mexico, our neighboring state, with that RT range under 1 at this point.
All right, so some really good news on that chart. Where do you think these active cases range? I know that since we don't go on and track how people are recovering and that there's not a set number of this, we have to rely on how aged out the diagnosis is. And that helps us better understand the likelihood of whether someone would have recovered. And that can help us in turn figure out how many active cases there would be in Arizona at this point, as it is on August 10th of 2020. How do things sort of look at that?
And that's a good point. We get, of course, we've always gotten the question about recoveries, and people say, oh, what's the recovery number? Well, we don't know what the recovery is. We can't report the recovery number because the AZDHS won't give us a recovery number because most of the county health departments have a different definition of what recovery is, and so they haven't settled on one. But one thing you can do is at least look at the age of the cases because we have reliable metrics as to how old these cases are. When they are put on the curve, they are put on the curve on the date of collection. So if you would presume that if somebody actually did have COVID-19 and it's an actual positive case, they're going to get tested within the last couple days. So you're talking about at least some verification of this number being accurate. So what we have is the active estimate of cases that are under 14 days is 15,433 cases. The active estimate of cases that are under 28 days, that is 44,116. So any way you look at this right now, about a quarter of the cases in Arizona are what you would consider active. So there's 187,000 cases, but only anywhere from 44,000 or lower is going to be an active case. So has the ability to transmit the virus. The others are simply just, they're too old. Whatever happened, whatever the outcome is, they're very likely not transmitting the virus after that point.
Yeah. And that's what Tyler Ryan writes. How about you show how many are recovered? So that's the best way, Tyler, that we can sort of figure what that number is. And Garrett, not to make the math even more basic, but in essence, you're taking the number of cases and then subtracting out from that, subtracting the number of people who lost their lives and then aged out of the case. And that gets you out of total.
And also subtracting deaths from that. So you take the age of the case and then you subtract the deaths and then you have sort of the idea of what the active cases look like.
Yep. So that answers the recovery question that I'm seeing pop up a lot. So let's see some of the other questions that are coming in we want to get to as well. Tell us why, Garrett, cases falling faster than the tests is important. That how would that line then break down to how would I explain that to a 5-year-old, if you will, for both of us who have 5-year-olds? When cases are falling faster than the tests, we're in better shape.
Yeah, no matter the volume of tests, when the cases are falling faster, the positive cases are falling faster than the number of tests that are being done, that at least tells you that the percent positive is going down. So, we found that unless we're starting to sort of mandate the testing for, opening up strategies, without some sort of testing mandate, we can only go off what the demand is in the community. And right now the demand is fairly low, but even in that demand, the testing percent is going down. So, we would be concerned, of course, if there was say we were only doing 10,000 tests a week, but 20% of them were coming back positive. That would be a huge concern, whether it be on the validity of the tests or the fact that we're having large community spread and nobody is getting tested. But that's not what we're seeing right now. We're seeing sort of the opposite. We do have low testing, but we're also getting a lower number of cases resulting from that testing. And one of the problems we're finding in communicating this is that, Johns Hopkins University COVID tracking, they do their best to get this data out, but they have our testing right now. They have our percent positive at around 14%, which is, it seems about double what it actually is. And that is because they pull the data from the summary page. So you see that those couple numbers that I showed you in the beginning, and that's what they're basing it off of. But they're not accounting for the fact that there's antibody tests in there. They're not accounting for the fact that there are some labs that don't report electronically that are giving positive tests. And in fact, those labs, because they're usually done from hospitals, have a much higher percent positive. So, they're bringing in a little bit more, PCR positives, but they're not accounting for that. So it's inflating our percent positive. You would see on, say, COVID exit strategy or Johns Hopkins University, anywhere they're going to show us with a percent positive around 14, anywhere from 12 to 14%. But in reality, it's probably closer to 7.
I want to get to some of the questions. Rick asks, is the governor speaking today? Rick, we haven't heard any information about when the governor plans to speak this week. He is back from the White House where he went last week, but we haven't heard anything specific about when he plans to talk, Rick. So as soon as we do, we'll, of course, let all of you know as well. And Lee Engelman writes, what is the turnaround time for testing? You're saying there's no lag time. So at the most, really, Garrett, it's 4 days, but we've seen it even faster than that.
Yes, I have. Let me pull up the chart. I just have to snip it really quick because it's a quick and dirty Excel sheet chart. So I'll pull this up really quick. This is today's testing chart. So you can see, there we go. You can see that this is the test process on August 10th, and this is the date that the tests came in. So as you can see, most of the tests that were processed came in from the last 3 days. When we see it, this is sort of this one right here. This is basically, that one is always going to be the state lab. It always has been the state lab. It's always a very small number of tests. And this is when Sonora Quest, ASU, all the big commercial labs start to report is on day 2. And you can see the vast majority of tests that came in the last 3 days, a little bit more 4, and then there's a couple from 5. And then after that, it basically drops to 0. So we're basically, if you're taking a test right now, you're getting it back within 3 days.
Yeah, that's awesome. Because what we saw before was unacceptable as people waited all around the valley and the state. All right, Don asks a question. He asks, if masks don't work, then why not open the state? Let me find his comment. I want to make sure I get it correct there, what he asked. So if masks are supposed to work so good, why keep things closed? So he asked this twice. Actually, I think there were 2 different Dons that asked maybe. Basically, the state is open except for the places that you can't really mask or that people didn't want to mask. So you can't really mask at the bars. There's this other comment. So Don, thank you. People weren't masking at the clubs because they were drinking. They weren't masking at restaurants because they were eating. They weren't masking at the workout centers because they were breathing heavy and trying to work out. Now, if they come to some sort of agreement where they'll wear masks at the gym, maybe that's when we'll see the gyms start to open up. But other than that, everything in Arizona is open. And as far as the schools go, it's a tough sell keeping masks on little kids. So that's the hang up there and why these metrics are written for the schools to try to get a handle on this before we have all those kids come back in and then they don't necessarily keep their masks on the way adults or their parents would like them to all the time. So those are some of the issues that we're tackling. But otherwise, Don, everything seems to be open here in the States, people, as long as they can mask. So hopefully that answers your question. Yeah, Katie writes, restaurants are open though. Yes, at half capacity. They're still at 50% capacity. So that's how they work around that. So Katie, that's exactly to my point. If businesses who are not open right now are willing to come up with a way to get around that by being able to keep people masked, then it's great. Yeah. Kelly writes, you can't wear a mask at the gym, lady. Hello. A lot of people feel that way. I don't want to wear a mask at the gym, Kelly. I'm with you. I don't want to wear a mask at the gym. So even if the gyms were to open back up and they required masks, I would still do what I've been doing, which is walking through my neighborhood with a giant brimmed hat on like a crazy lady. So that's the way I'm getting around it, to be able to keep myself safe and my family safe. So yeah, a lot of people don't want to do that. Some people do want to do that. They say, I would gladly be able to go back to the gym and lift and just take more breaks, but wear a mask. So that's going to be the conversation likely this week, Garrett. I saw on the AZDHS website on the very front page there, they had, let's see, now it's got a heat warning up there, but right below the heat warning, it says that they are working to get the compliance orders in place for gym and indoor fitness centers. So all of that is going to have that specific executive order and those parameters for how they can finally be able to reopen. Kelly's not a fan of mine. It's okay, Kelly. It's okay. I'm not for everybody. It's all right. You don't have to be a fan of me. That is just fine. It's okay. The DMV is still closed, Colleen writes. Yes, and that's why we've got some information on our website on how to get the things you need from the DMV. Joe Ducey let Joe know they had information on that, and let me know if you can't find that. Email me if you can't find that specific information on our website. But abc15.com/coronavirus is the place to find that. Look for Let Joe Know, and he'll have all the information on the DMV. Let's see. Oh, Matthew writes, we love you. Thank you, Matthew. Very sweet. And Eaton writes the same thing. We love you, though. Thank you. Let's see. Oh, thank you. You guys are so sweet. Thank you for all the love. Thank you, Margaret. Very, 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 very kind. Margaret, I'm glad you're joining us on here again today, by the way. We hadn't seen you for a couple days, and I'm very, very glad you're back. You always add thoughtful conversation in here, as do so many of you. All right, let's see. We got some more stuff to get to. Let's get to hospitalizations. Boy, some really good news there, Garrett. I know that there is one leading indicator that always makes you and I concerned with the ERs, and I know that was up a bit today, but that doesn't necessarily mean we're in a bad spot. It's just something we got to kind of keep our eye on a little bit.
Yeah, absolutely. So I've got my screen shared to the AZDHS dashboard. So we'll go here. You can see 1575. This is inpatient positive. So basically any bed at a hospital that isn't a maternity ward or a ICU bed. And you can see 1575 are COVID-19 patients. That's about 20% of capacity right now. Very low compared to where it was at the peak. And that's about where we were in the middle of June. Ventilator use also decreasing, 366 today. ICU beds also decreasing, almost under 500 for ICU beds at this point, where we're getting to that point. We haven't been there since, it appears, again, June 15th. We're kind of where we were in June 15th. You'll hear that narrative a lot. The discharges, 321. You can see they are kind of switching a little bit. There's a little bit more. So that might be with longer stays are now being resolved from the people who had a heavier case of COVID-19. They're now being discharged at a, just the lag is starting to appear in the system. And then again, emergency rooms, usually a very big leading indicator, down under 1,000 today. That's great. It hasn't been under 1,000, obviously, for quite some time. It looks like June 28th was the last time it was under 1,000. And again, we're still talking about this curve. This curve isn't going, it's still going down, but not at the rate it was for those first 2 weeks. It's sort of settled into a different sort of pattern, but still a pattern of descent. And then intubations did go up slightly, 61, but this is a noisy data set. This is something you want to look at by week and not by day.
Yeah, that's interesting. Micah writes, with ventilators, does that mean there is a total of 366 ventilators in use in the entire state?
No, there's 703 ventilators in use for the entire state. This is this number right here, the hospital bed usage and availability and ventilator usage and availability. These are COVID agnostic numbers. They just care about the bed count or ventilator count, not who's what symptoms and what the person is using them for. So 703, 36% of the ventilators are in use right now. That is down from 53% at the height on July 15th. Since we're here, we'll just go through the other numbers on the census as well. You can see our ICU beds down to 81%. That's down off of the high of about 91%. Emergency room, still sort of in this same vein, 39%. And then inpatient, which is the general acute care, down to 80% off of the high of about 88%.
So, Garrett, when we were talking ventilators before, we've always, as a state here in Arizona, been in decent shape as far as the ventilators go. As I look at that chart too, and as we sort of went over that peak and kind of came down to the valley again, we really never got to a place where that particular number was a concern for us.
Yeah, correct. This was never a concern, even at the peak when Governor Ducey and Dr. Chris were doing their press conferences. Even when things were looking very bleak out there, they always said, we are fine on ventilators. The state has ample supply of ventilators. Now, there was a concern at the time that some of the rural hospitals would have issues with ventilators because, most of the ventilators are in Maricopa and Tucson or Pima. And so there was concern at the time in Yuma County, some places in Cochise, the Navajo Nation, that they would have issues in those areas. But I presume that at this point this has subsided, because even though we've talked about how these are statewide numbers, we're seeing basically downgrades everywhere. So I would assume that even though, again, statewide numbers, it also is reflected in the rural counties as well.
Yeah. Let's see. What states, now that, boy, the pressure is off Arizona as we're getting to a better and better place, what states are currently sort of in the hot zone? I know, we've seen some of these other states light up, and there's two ways to kind of look at it, I guess, Garrett. The way they were last week and the way they are this week. Are we comparing week to week or comparing state to state? There's a couple different ways, because, we were really still in it. And when some of the national newscasts would show our map, Arizona wasn't even lit up at that time because we had been in it for a while, and then other states were picking up the pace. I saw Alabama start to have a higher number. Where are things looking across the country?
So we'll go to 91 DVOC for that. I have that shared, and we'll put that up on the screen so people can follow along. This is 91-DVOC.com/pages/COVID-visualization. So this is, and I'll highlight some of the what's been going on. So this is per capita, new cases normalized by population. You can see there was a time back in early July that Arizona was the peak in new cases, even higher than New York in new cases on a 1 week average. But you can see that time is long past. We're now sort of in the bottom pack. I'll highlight some of these other states just so it's easier to see them that are sort of in the lead right now. Louisiana seems to have the highest number of new cases normalized by population. So that is the sort of leading state right now. Second in the line it appears to be Mississippi, which has obviously was up there with us at one point as well. And then we'll go to Florida, which seems like the third. So it looks like right now, and then Alabama is just under that. So it appears that right now, case movement, while everything's still going down, at least the sort of the southern region of the United States seems to have some other here. We'll do this by region here. You can see here's the north. Wait, I've got it. Florida. Hold on a second. Sorry about that. It seems that the regions are. It's hard to see. I'll see if I can get the regions in here. U.S. South. So I'll highlight U.S. South. You see right now, U.S. South definitely has the highest caseload, followed by the U.S. West. I believe that is where we are put, and then U.S. Midwest, and then followed by the U.S. Northeast.
That's interesting to watch too, as we watch hurricane season sort of ramp up. That becomes a concern because these places are becoming hard hit, and even New York with all the storms that they saw and the tornadoes because of the hurricanes that have made their way through. We're really watching some of those eastern states or anywhere that could be hit by a hurricane this time of year. Cindy was asking about some of the new cases. Let me see if I can scroll back to her comment just a second ago. Okay. Cindy Kelly asks, how many people are being tested multiple times and counted as a new case each time? Cindy, the good news, this is kept like a medical record, so it's deduplicated. So you can actually go get tested several times, maybe you've tested positive and you're trying to go back to work, so you keep having to go get tested to try to get a negative, that's deduplicated. So you're only counted as one case. So Cindy, thank you for that question. That's a question that we haven't answered in a while. So thank you for that. Kathy writes, thank you, Katie and Garrett. Your insight is so valuable for AZ residents. Kathy, thank you for saying so. That means a lot. Let's see. Anastasia is asking about the Navajo Nation, and I'm so glad that question came in because our morning anchor, Nick Saletti, just spent time up on the Navajo Nation doing some very in-depth reporting, and you can watch it mornings here on ABC 15 throughout the week. I'm hoping that we'll run a smaller snippet of it in the evening hours tonight because I didn't get to catch it this morning. But if you miss any of our reporting, you can find it on abc15.com as well. I know it takes a bit of time to gather the story, come back and put the story together. So in that time, things may have changed just a slight little bit. We know that the Navajo Nation is still doing the shutdowns on the weekend to try to mitigate the spread that's happening, but they've made those closures shorter. In fact, instead of happening on Friday nights now, they're usually happening at 9 p.m. on Saturday night and then lasting until 5 a.m. on Monday morning. So how do things look up there right now, Garrett?
So the Navajo Nation, as far as the number of active cases, it's about the same percentage as we have across the state. It's about 23 to 26% of the cases they have up there are active. They have 9,300 cases in total. And they're saying that 6,900 of them have already been recovered. So again, about 23% of the cases are active. They have not had a day above 50 since July 31st, adding 50 to their case count. And they haven't had a day above adding 100 since July 17th. So the average number of cases they're adding right now on a 7-day rolling average is about 30. And that's been the case basically since the beginning of August. They've been at about 30 cases average a day.
Wow. So it doesn't sound like they're going to let up on these weekend closures anytime soon, that they really want to continue to have a handle on this. So we'll keep you updated and check out Nick's reporting. I saw somebody comment that they were happy Nick was up there. Absolutely. Anytime we can shine a light on that community and let people know what's going on up there, we're happy to do so. Let's see. April asked a question just a bit ago. How soon can we get to that low 7% positivity rate? I know that that's so important, April. I want to get to your question. She says, I want the guru to tell us how long he thinks it'll take to reach that 7% positivity at this rate. So the important part about that 7% number, that the reason we're talking about that so much, and 5%, is because it mirrors some of the metrics that the state has set out for the parameters for school districts to reopen. So how soon?
So it appears that, I mean, right now, when we look at the PCR, and I've got it pulled up, the PCR percent positive for the week, and this is the metric they are using. They're not using the positives. They are using the weekly percent positive. So we're going to spend a lot of time with this graph when it comes to talking about schools. And it needs to be for 2 weeks consecutive 7. So, and not counting this week. And you can see why they wouldn't count the most recent week is because it barely has any tests in there right now. So right now, the week of August 2nd, we're looking at a 9% positivity rate, and the week of July 26th, a 10% positivity rate. So if we're looking at a 1 to 2% decrease on a weekly basis, I'd expect that within 3 weeks, this will start reading 7% for at least 2 weeks. So that's the earliest we could be in the 7% range statewide. Now, this is statewide, mind you, would be in about 3 weeks. As far as every county, because I know they're doing stepwise for counties, that might be different. As you can see, if we look at Coconino County, they're already actually in the 6 to 7% range right now. Maricopa County, let's go to that one. Right now, they're at 9% to 11%, so it's going to take a couple weeks for Maricopa County. Pima County, we'll see that one, 9%, 7%. So they already have 1 week basically on here that says 7%. So if next week, so by this time next week, they have another 7%, then technically they've made that 7% threshold, at least for the percent positivity. So we're going to keep watching this, obviously, but you know, as far as the state as a whole, probably anywhere from 3 to 4 weeks at this point.
So 3 to 4 weeks, then plus that 2 week hold.
So yeah, I mean, you have to. That's exactly what I would say. we have one more week of waiting for this most recent test to go in, and then another week for that next week to go in. And if
Right.
both of those are 7%, then another week to wait for basically for the data to stabilize.
Okay, so at best, it's
all, and then of course at best, it's always going to be 3 weeks.
Yes.
Yeah. But I mean, it's looking like, at least in some counties, that it could be 3 weeks. Maricopa, it might be 4 to 5 weeks to get there and to have the sort of the cooling off period on the week. But we'll see.
So I'm looking at, because Thursdays are the day they judge it from. If you went 3 weeks out, that would put us almost right up to Labor Day. So it makes sense that a lot of schools at least push their in-person possibility of instruction back past that date. And if we went to 5 weeks, that already puts us to September 17th. We're getting very close to that fall break for a lot of schools. Hence why so many schools said, we're just going to bump it all the way out to the fall break. So April says, nice explanation. Thank you. April's so happy to help. So that kind of helps us better understand, people were thinking that they could just go out and have a bunch of people who presumed they were negative go out and get tested and try to hopefully sway the numbers in their opinion. But really, you wouldn't all test negative, likely. There would be a few positives in that mix, and you wouldn't be able to sway the numbers that quick if they were checking it every Thursday. So all of those things sort of kind of worked against that. Even.
We're also hoping to see, Maricopa County has promised a sort of district by district dashboard for COVID-19. We haven't seen it yet, but I'm really looking forward to seeing what that will look like. We have a friend of mine on Twitter has done some work on it to sort of estimate what those numbers are, and it does show that there are certain districts, especially the sort of the center of Phoenix districts, that have been hit harder than some of the other districts, and it sort of gives an idea of what that dashboard is going to look like when it's done.
Yeah. Hey, Rihanna asks a really good question. Rihanna, I'm so glad you asked this. What would happen if for a day or two it spikes? So we have to start all over at day one? No. Really good question. They're averaging it week by week. So, that's a different one that she wrote. Thank you for being so active on here. Her question literally writes, what would happen if for a day or two it spikes? Would we have to start all over at day one? And Rihanna, no, you don't have to start over at day one. This is averaged week to week. So it's looked at I'm assuming probably looked at on the Wednesday and put out on the Thursday, or looked at Thursday morning and submitted on that day. So really good question. I'm so glad we got a chance to answer both of those and learn more about your friend who's working on that dashboard. Okay, let's see. Want to get back to some more of the questions. I know that we have so many different things to get to, but I want to mention this, the trials. If you are interested in being part of the solution to all of this and the trials that are happening, there is one that is just getting started. cctresearch.com is the site if you believe you could be part of that solution to finding a vaccine. cctresearch.com. Or the other site that is enrolling people is hriaz.com, and I believe they've already started some of theirs. In fact, the 100th person here in Arizona was just given their shot. So whether it is a placebo or it is the actual hopeful vaccine out there, they've already administered that to 100 people. They say between the ages of 18 and 80. So if you think that you can be a part of that, that can be something that you can take part in. Also, if you think that you need a test, oh, look at this. Producer Josh is right on my wavelength today. If you think that you need a test or you are curious, here is the website to go sign up. Do I need a COVID-19 test.com. That will send you to the closest site, the nearest site to you. You can go in there and choose whether you'd like the nasal test or the saliva test. I took the saliva test. It was so easy, and you get the answers back pretty quick. I believe at last check, they were doing those tests on Tuesday and on Saturday over at the stadium. So you can go out to Cardinal Stadium. You do have to register ahead of time. So make sure you go to that site, and that can help you get the information you need, get the date that's the best, or the specific test that's the best. Okay, Debbie asked a good question. I don't understand how we can go from the worst in the world in terms of infection, percent positive to so low right now. Oh, her comment just jumped away. In 1 month, how is this possible? Is this Garrett really only possible because of the mitigation strategies that we took, and maybe sort of it kind of got everybody's attention when stuff got real bad here, and everybody went, okay, we're going to have to solve this, or my kids are going to have to be schooled at home in the we call it fall, but it's really right now, August, in the end of summer. And when people got serious about making sure that we slowed the spread.
Yeah, and that's in many ways that's exactly what you're talking about. That's correct. So obviously, we were shooting up very quickly. Things did turn around very quickly, that's for sure. But we have sort of detected sort of that mitigation strategies at least have played some role in this. When the governor issued the mask order, we were at the peak, and within 2 weeks we started decreasing. We also saw the mobility index that are put out by a bunch of companies that sort of randomize cell phone data and look at sort of how much people are traveling. We also saw that starting to fall as well. So those two things kind of show that people were starting to take the virus more seriously at the time. And also just to remember, in many ways, the virus, when we were even at our peak, it was still sort of localized in so many places. And there were places in Maricopa County even that didn't have that high of an increase, even when we were at our highest increase. It was sort of localized as well, and that's sort of how this thing transmits. If people are staying home and they're not really going from one side of the valley to the other, then the virus is going to stay in one area. But that's sort of, those are sort of the things we saw, going through this. But yes, it has moved quickly. It's moved very quickly. And it's going to take a while for like epidemiologists and other people to figure out why that rate of transmission spiked so much and went so low. That's going to take several years of study. And we're going to figure that out in due time.
Like I said, when all of this started in March, there will be full college courses just on coronavirus in the future and understanding, what just happened here. Sherry asks, when are the small bars able to reopen? Sherry, it all depends on the liquor license, the number on the liquor license. So that's what they have to wait for clearance from the state to be able to open based on that number. So some of the smaller ones, Garrett, I'm not familiar enough with the exact numbers that are attached to it, but I know if they're like the giant clubs, they have a different number than some of the smaller restaurants and things like that. But that's what we're waiting on. That's the information that everyone's asking the state. Let's see. We just have a few more seconds. Oh, you know what? Producer Josh is helping me out here. Series 6, 7 licenses were ordered to close. So it they can still do the takeout. They can still even take out drinks in many cases, which we didn't see before COVID. But the Series 6 bars and then the Series 7, primarily the wine bars in all of that. So it's all based on the license, and we'll continue to try to provide information as we hear about any changes with things related to that. Let's see. Garrett, what other things did we not touch on today? I want to make sure we get to each thing. And as promised, each and every day, people were asking about how many kids are testing positive right now. We're seeing some more national conversation as schools open up in other places about some higher numbers. But how do things look here in Arizona? And I should tell folks on here that they only track 20 and under, so we don't have a breakout for Maricopa County any more specific than that.
So yes, we have, when you look at the AZDHS page, it's about 12% of all active cases come from the under 20. I didn't see any significant movement in that group in the last couple days. So there was a time last week where it was that under 20 was increasing at a higher rate. It seemed to coincide with college students going back to school. And I know that some colleges did require some sort of testing in order to do that. So that may be an explanation as to why that number was increasing by a little bit, but it's not really increasing to that same level anymore, staying at about 12% and not a whole lot of movement right now. So in this group.
So I want to show everybody where they can find that on the AZDHS site when you're breaking that into the demographics. So this is the main page.
Yeah, I'll just go right through the entire steps. So I'm going to take you directly to the AZDHS.gov main page. You go to the data dashboard link. It takes you to this page, and then you go to this demographics tab, and this is where you find how the demos break down.
Thank you. That helps to show. I know there's a couple different things, both breaking down the cases by race and ethnicity and the age groups. And then the other nice thing is you can highlight your particular area. So wherever you all are watching from, you can click on your county to see how the breakdown is affected. All right, we are running out of time here, and I want to let everybody know where they can find us, where they can get more information on the Arizona response and situation to coronavirus, and that is on our website, abc15.com/coronavirus. Our reporting from today and all the way back since this thing started, since we started reporting on it to you on January 17th. You'll find all of that information right there on our website. You can also find Garrett and I. Garrett is even busy working for us on the weekends, posting information at Garrett_Archer on his Twitter account. My Twitter account is at Katie Raml, one word right there, first and last. And you can find me on Facebook as well. We've got a really good conversation going on over there, facebook.com/news from Katie. We want to invite you back tomorrow afternoon, as we do each and every day, breaking down the numbers as they pertain to Arizona on coronavirus. We'll see you tonight at 4, 5, 6, and 10 p.m.